So thank you all so much for being here. If you haven't been able to, if you could enter your name, pronouns if you're okay with it, your title and organization and email, and if you're affiliated with a coalition in the chat, that would be super fantastic. That's how we're going to do our introductions today. And thank you all so much for being here. As a reminder, this is one of our quarterly webinars that we have where our intention is to share cutting edge information and best practices in Oregon on suicide so that across the state we can move these practices forward and just share information with one another. In addition to these regional coalition webinars that are open to everyone, we also have quarterly regional coalition leadership network meetings that are intended for our regional suicide prevention coalition leaders to come together and just share challenges and things that they're working on that are going well for them, so that way they can just learn together and really we can build that network connection across the state. As Annette shared earlier, my name is Jen Frega. I use she, her pronouns, and I'm one of the staff to the Alliance along with Annette. And today our focus of this webinar is on our firearm safety and lethal means restriction advisory group that we have and just the work that's been done through the Alliance and other connected partners. We have a couple of speakers, well, we have a handful of speakers today. We have so many folks who are going to be able to share the great work that's being done. And this is just a quick overview of the agenda that was also included in the meeting attachment. But before we get started and look at all of that, the good details that we'll be talking about, I just wanted to quickly share our vision for the Alliance, which is that in Oregon, all young folks have hope, feel safe asking for help, can find access to the right help at the right time to prevent suicide, and live in communities that foster healing, connection, and wellness. In addition to our vision, I also really do just want to touch on safety really quick. As you can tell from the title of our webinar, we are going to be talking about lethal means, which are things that folks use to attempt suicide. While we are going to be talking about the types of means and may say things like died by firearms or the rate at which somebody dies by different means, we are not going to go into specifics. We won't be sharing details of attempts. We won't be sharing any specifics. It'll really just be general terms just to talk about the work that's been shared. With that being said, if you do find that you're having a hard time with what we're talking about today, whenever we're talking about suicide, it can be difficult, especially when we're talking about means. I have some crisis lines that you can use towards the bottom of this slide. So there's the Lines for Life number, there's the crisis text line, and also the Oregon Behavioral Health Support line. You can also, Annette, is it okay if I say that people can message you as well? Can I put you on the spot for that? Oh, you're muted.
I have to unmute. Absolutely, yes.
Okay, awesome, thank you. I should have asked her before. Also, if you just want to message somebody in the webinar, feel free to message Annette or myself. If you just need somebody to connect with, if you just find that you're having a hard time. And these crisis line numbers are also open all the time. So even if something comes up later, you feel free to reach out to talk to somebody. Okay. These are just some quick safe messaging reminders. I went over it a little bit before when I talked about like what we will and won't share. And these are just kind of up there just as a quick reminder. Okay. As we get into really the core of what we're here to talk about today, which is the Alliance's lethal means work that we've been able to accomplish, I just wanted to give, this is just going to be a really quick, not very in-depth history of how it started. It's really just to kind of say what the original focus of the work group was, which was firearm safety. As we know, the vast majority of suicide deaths is by firearm. So that was the first focus of the work group, was to really look at what could be done what we could do to help with that, what we could do messaging wise or just legislation, advocacy stuff. And that's really all I'm going to talk about with the history, because I really want to give enough time to Alyssa to talk about something that was one of the original big projects of that work group with the focus on firearms, and that was the firearm owner focus groups. And so that was really the beginning of the work group and where we started and what one of the big focus areas was in the beginning. And Alyssa, I will now turn it over to you.
Should I pull up my slide deck or should we? Okay, we're good to go. So welcome everyone. Thank you for this opportunity to kick off this really important topic of lethal means and firearm safety. I had the privilege of working with Jonathan Hankins and Susan Keys in the spring of 2019 with a early series of virtual focus groups back when we were first going virtual, and just wanted to share with you all some of those findings that have gone to impact later work. So a reminder that we are at Lines for Life, are a regional nonprofit who work to prevent substance abuse and suicide. And this is one of the ways that we advance hope, health, and recovery for all. So firearm safety has come to attention as folks look at suicide rates and the lethal means used in suicide. But I just wanted to remind everybody that our focus here at the Alliance is suicide prevention. And this is data from the most recent Student Health Survey 2020 during COVID, in which we asked, in which the state asked students to talk about how long it would take them to get and be ready to fire a loaded gun. And in this instance, I could not get a loaded gun, the higher number is better. And what we are trying to do is increase that percent in our outreach initiatives and efforts. What's alarming is that 43% of 11th graders, the state is also available for 8th graders. I just pulled the 11th graders as an example, talked about feeling sadness and hopelessness, depression for 2 weeks or more. And if you look among those who had that experience, about half of them indicated that they could get a loaded gun. And as many as 23% could get it in less than 10 minutes. If you actually look at the next slide, which looks at folks who have seriously considered attempting suicide, again, we are looking among those who say yes to that, and among all 11th graders, it was 17% of students who said yes. The number who could get a loaded gun was actually higher from those who did not report seriously considering a suicide attempt. And again, our goal in the work that we do is to increase that number in yellow. We get to as high as 80% of students do not have that ready access to guns. So with that backdrop of that purpose, what did we try to do? So we identified 31 firearm owners. We conducted 75-minute group or individual interviews, all of which were conducted on Zoom. Susan Keys served as our moderator. Folks were recruited primarily through personal networks of folks at Lines for Life in combination with our partners, including the Alliance, AFSP, OHA, and veterans and military contacts. Our goal was to better understand how firearm owners communicate and practice firearm safety. The reason we wanted to do this is to understand how best to advance cultural norms around safe storage and reduce stigma around mental health and safety planning. Many indicated that in the gun community, and particularly among military or law enforcement members, there was significant stigma around mental health. How do we address firearm safety with firearm owners in ways that respect and protect the rights of gun owners while keeping persons who are suicidal safe? So that was the approach we took. And I just wanted to share some summaries of what we heard and the kind of issues that arose. For example, one participant explained, the state of Oregon has taken an approach to criminalize non-safe storage of firearms if those firearms are stolen or used by someone in an illegal manner or to commit a suicide. And that has been part of the gun control agenda. And this coerciveness and this whole concept of coerciveness came up again and again as something that they were highly resistant to. It tends to turn a lot of gun-abiding gun owners off. So this suicide prevention aspect gets confused in the gun control aspect, and people tend to resist it and find it coercive. Instead, give a tax credit for the purchase of a gun safe. That's more involved than gun locks, which work but are pretty minimal. And then that might be an approach that might be more welcome to encourage change. More generally, regulations and government agencies were suspect when it came to firearm safety or temporary separation from firearms. I would not relinquish my guns to an agency, but I would gladly give them to my family. Another example. There was recognition that individual outreach would be needed to encourage change in safety practices. I think that it's got to be a personal message that they connect with. I thought the same way too, but this is what I found when my child attempted suicide. This parent went on to think through how a gun owner might respond to outreach. I'm not going to talk to you if you are not a pro-gun guy. Whereas a gun owner could engage from a point of solidarity. I agree with you, but there are some better ways to do things. Some thought that gun store clerks and staff at shooting ranges could initiate these conversations as well. A final example from the focus groups. Participants expressed that they and others they knew felt bad and even responsible if a suicide happened or were to happen with someone in their family or circle. This was not an experience that they wanted on them. One shooting instructor shared that a person he trained, including safety training, told him that they had come close to suiciding. The gun was loaded and in hand, and stopped because they knew how bad the instructor would feel if that person had completed. Another grandparent said that he had purchased a safe primarily to protect his wife because she was the one primarily at home with the grandkids, and it would be her fault or responsibility if anything happened. So it's a community and culture in which personal responsibility is taken seriously, in which coerciveness is resisted, and which gun owner to gun owner communication is prioritized. Next slide. Thank you, Jen. Language matters, and those of us in suicide prevention have seen this across all topics and populations. It was really important that a person responding to a person of concern asked for permission. Phrases or strategies that gun owners thought they might use to respond to a person of concern or a person in crisis. I'd expect you to do the same for me because we care about each other. I am coming from a place of love. Is it okay for me to hold your guns for now? One person noted the difference between access and possession. An option would be to say something like, how about I take the cylinder out and keep it for a while? How about you lock them up and I take the key so that possession remains with the gun owner, they just no longer have access to it. Relatedly, when talking about suicide prevention, gun owners felt it was important for people to understand the mechanisms of guns and how to take them apart. In part for this safety aspect. Words that seemed comfortable to use were talking about developing a mental health safety plan. For example, if a fellow, someone you shoot with is going through a divorce, it might be an opportunity to raise, if I, start to worry about you, what would you like the response to be, in ways of talking about safeguarding or safekeeping guns in ways that felt comfortable to the gun owner. So here are some of the key takeaways. Concealed carry permit holders seemed a priority population for outreach and education, in part because there is required education for them, and also because those with concealed carry permits are the ones who most want to keep the guns accessible. Integrating suicide prevention with hunter education that is provided at young ages. Many talked about growing up in a gun culture that emphasized safety. Prioritizing gun community awareness and education, friend to friend and family member to family member. Social media, but also print, literally things sitting at the counter at gun stores or tucked within gun sale purchases by gun owners for gun owners were seen as impactful, including national campaigns. Consider a way to certify providers, and I'm talking healthcare providers or behavioral health providers, which are often listed low on the list as effective messengers. So figuring out a way for folks to know in advance if their provider is gun conversant and friendly and ready to support gun owner safety. Another challenge is that gun owners want their guns accessible for safety. Storing it may make them feel less safe. They need storage that is fully accessible for self-defense. So thinking through with gun owners how they can stay safe in terms of the reason they even have the gun to begin with is important to developing collaboration and cooperation. And finally, direct and clear communication was seen as a gun culture value. Encouraging mental safety buddies and pre-planning seemed possible. Parallel scenarios that participants mentioned were designating a sober driver, taking someone's keys away to prevent drunk driving, and designating a guardian for your children. Your gun, which is a possession, has a guardian like your child. So those were just some of the approaches that were suggested by focus group participants. So I wanted to take a moment to pause here, in part because there are others on the agenda, and in part to get a sense of my audience in terms of how many of us serve as gatekeepers or are pretty well versed in suicide prevention. So if you could just give me a sense of what suicide prevention trainings have you taken, that'll give me a sense of whether to just cruise through these slides or move on to the next presenter, or whether to just spend a little bit of time providing this orientation.
So Alyssa, when I created the order for this poll, I looked at OHA's fun, fancy river, because that's what a river is, I'm doing in my hands, and that's how I ordered it. So I feel like the farther down a list you go, like the higher level of training you get. If that was just the way that so where's what connect is at the bottom. So when I tell you the results, it looks like the highest level that folks in this group have done collectively is assist, with still more like going beyond that with use, save, calm, cams, and connect. But overall, 70% of folks have done at the very least assist and QPR and mental health first aid.
That's awesome. So many of you may be familiar with the fluid vulnerability theory, which basically reminds folks that for that suicide risk Oh, cool. Thank you for sharing that. Reminds folks that suicide risk is often triggered, that there is a short-term or current acute crisis, and that folks' baseline level of risk differs. So for what one person may be an acute process, another person, that's just their baseline risk level. Next slide, please. So it's just really important when we think about firearm access is just recognizing that there's a short period with which we want to intervene, that that's time limited, and that external risk factors are what we need to be paying attention to. Next slide. I'm going super fast. And it's so these triggers such as relationship problems, financial stress, perceived loss, physical sensations such as chronic pain, negative memories as in PTSD are the times of things that might move people from their baseline state to an acute state when they're at risk. So this is what we as gatekeepers are staying attuned to. And I am just going to go one more slide and then I'm going to stop. So just a reminder, these are helpful things to say that can work with members of the gun community, but also in any situation. It's okay to be anxious or scared. I understand that you're feeling angry. Anyone facing this would get upset. I'm so glad that you told me you're feeling really lonely. This is really tough. I'm here for you. Tell me more. I love you no matter what. So I'm going to stop there. There's some additional slides about that gatekeeper role. And again, the reason this firearm safety stuff is so important is because we need community members to step in and be there for a person at risk. Thank you so much, Jen and the Alliance, for the opportunity to share this work. Really am excited that so much has happened since 2019 that others are now going to report.
Thank you so much, Alyssa, for sharing all of that and for just sharing all of that wonderful work with us. There's been a message in the chat that also says such amazing work. So thank you so much for sharing. So with that, I feel like those focus groups are really the culmination of the beginning of the firearm safety and lethal means work group. When it first formed, so much work was done, and that was really something that they saw as just extremely important to be able to hear from folks and to be able to see what exactly, like Alyssa said, firearm owners said about how to interact with them. So that was a huge thing that was able to be accomplished. Once those recommendations were completed and submitted off to OHA, and then the report was made, it's also available on our website. Alyssa had shared the link. I have the link. I just can't access it right now because it's in the notes, but it will be put in the chat at some point. If not, it'll be included in an email out to everybody afterwards. But once that was done, the group decided that they wanted to, while still keeping like a pulse on firearms as just things arise real time, but we also wanted to look at some of the other lethal means that are in those top three, so that way we can see what we can learn about the different types and to see what we can recommend policy practice wise for how we can reduce. And so now the work group, the advisory group, has branched off kind of sort of into two smaller groups, with one looking at suffocation and strangulation and the other one looking at opioids and overdoses and poisonings, with suffocation being the second leading cause and poisonings and overdoses being the third leading cause of death, of suicide deaths. So we still meet as a large group, but there's like just those two subgroups within that larger group that what they do and what we do is we go out and we just research things outside of our normal meeting times. We try and find guest speakers to come back and share what they know and their expertise with the group, because right now we're really in a big information and data collection and gathering mode to see everything that we can learn, so that way we can correctly craft different recommendations, both legislatively, and just whatever recommendations we can craft for that. And so those are our two current focuses. Is it foci? Focus is one of those, one of those ones. And so within that, Jonathan Hankins, whose name is currently up on the slide, is the current chair of our group, with Pam Pierce being the one who's leading our efforts on our opioids and substances. And Donna Marie Drucker is leading our efforts on the suffocation and strangulation. And Pam, I'm not sure if you are available and okay to kind of share a little bit about what we've learned so far with our overdose subgroup within the larger group. And we can work together on this if you would like, but I'm not sure if are you available to do that?
Yep, I can quickly, I apologize, I'm in the car going to an appointment with my daughter. But what we're experiencing right now with it's hard to determine unless it's obvious whether or not someone has accidentally or unintentionally overdosed, or if it was a suicide, because they're very linked. Suicide and unintentional overdoses have connections both with pain, physically, emotionally, and opioid use. If someone is using opioids regularly, there are quite a few factors going into whether or not it is unintentional or intentional. Prevention and awareness in our communities, educating people on what is currently happening especially in Oregon, with the decriminalization of illicit drugs. Currently, we are seeing something that it's new, and I think I read recently the opioid, it's the second leading cause of suicide. But again, it's something that we're trying to gather as much information as possible. SAMHSA has great information. Song for Charlie is a new organization that has a great website. It has great resources. It has educational materials for teachers, for parents, for young people. The Addiction Policy Forum is another organization that has a campaign that is specifically targeting this issue, but it's something that we are paying attention to, and it's kind of something that we're learning as we go.
Thank you, Pam. And some of what we've learned so far with our initial recommendations, and even just stuff that we've learned that would be really important as prevention measures, is really taking that a harm reduction approach of sorts. Examples of things that we think would be good recommendations, and just stuff that we're thinking about how we can advocate for, are things like having fentanyl test strips available in the community for folks to be able to have easy access to. Same thing with Narcan, just being able to have people have that around. Harm reduction sites for even like safe needle exchanges are just really important resources to have for community members. Just really taking a harm reduction approach is extremely important. Other ones that we've talked about with prevention is really just that education, and just doing what we can to educate, especially the younger ages about. And I think that it was Donna Marie who shared that there was a program that she used to help out with educating about substances in elementary schools. And one example of an activity that she did with the younger kids, just to show how this can be easily adapted depending on your age and the developmental level, is that she would show examples between Tylenol or even a vitamin gummy and something different, and just say which one looks safe and which one doesn't. Just have those different conversations about what substances like that could look like, just to keep the youth safe. So if they see something that looks really pretty and looks like it could be a good candy, but it's really not, so that way they can just learn to identify that to keep themselves safe in that way, and just to increase that education level. But those are just some quick examples about things that we're starting to learn about, resources that we're learning about, and some brief overview about some of the recommendations that we're thinking about how we can advocate for. Our next speaker is not here yet. She's coming from another meeting. So I was wondering if folks so far have any questions or things that you would like to talk about while we wait for our next person to rise. So any questions about Alyssa's presentation or about the opioid stuff that we just briefly discussed, any ideas that you all have.
Jen, Vicky was asking some about the new gun storage laws and if we've seen any impact about that. And I put a link to an article that does a pretty good job of describing the laws. And I don't think Megan's on. I don't know if we have the data yet. They're so new. So I think that's an open question. There's Megan answering. Yeah.
And our next speaker, Donna Marie, when she comes on, she'll be talking about one of the recommendations that came from the firearm owner focus groups that Alyssa had shared about earlier, which was the creation of an Oregon Firearm Safety Coalition. And so she may have, I know that some of the work that they've been doing is learning about that particular topic and advocating for stuff related to that. So she may also, I know that Megan just shared something, but Donna Marie may also have additional information when she arrives about that.
You know, I wonder, Jen, if Donna Marie isn't here, if it makes sense to jump forward to Jonathan's section, or what makes sense?
Yeah, so Jonathan, his section was to kind of introduce Pam and Donna Marie and just to talk about the new focus. He is experiencing, he's unable to talk right now, so that's why I kind of did that for him. And then the person after Donna Marie is also going to be coming from another meeting.
Well, let me ask this then of folks who are on here. What, you know, just in what you've heard so far, how would you take some of this information back to the folks you're working with? Like, I'm always interested in how do we take this kind of conceptual stuff and actually put it into practice? So whether you work with a coalition or an organization, like, what are you going to do with this? Even like looking at you, Liz, from OYA, I'm thinking about, you know, maybe these are conversations that Oregon Youth Authority really could be having with families, or, you know. Any thoughts about that?
And I know there's a lot of individuals on this call that can fully speak to this, and I don't want to put them on the spot. But it's really interesting and awesome to see all of this work that's coming forward. And in one way, as you may know, through your organization, this information is starting to be taught out in our communities in Oregon through the Oregon COM training that was adapted from the National COM.
Yeah, so Charlotte, I'm gonna say I'd love to just hear a word or two more about the COM training, and I didn't remember from that list how many people had taken COM or not, but it seems like it's such a vital resource.
This is Charlotte. I can feel free to.
Thank you.
Okay. Charlotte's like, Megan, start talking about Oregon COM. So COM, Counseling on Access to Lethal Means, is a national online course that anyone can take for free. Someone else can, or I'll put in the link in the chat. That really is for direct service providers, not just medical, but anyone that may be having a conversation with an individual about firearms and safety planning. And very highly recognized nationally. So there have been efforts to provide that course in live, either virtually or in person, recognizing the value of role playing and discussion that can go along with that, recognizing that this can be a challenging conversation. So in August, OHA hosted a Oregon COM T for T We had 15 people from around the state participate, and we've been supporting that training cohort. Chris Bifocal at AOC and HP is working with OHA to support those trainers in a learning collaborative. And Charlotte and Michelle are actually doing the first Oregon COM training a little bit later, and we have other trainers kind of starting that process. And we plan on holding additional Oregon COM T4Ts later this year, and really kind of growing that. And really we did this effort because we were hearing from local communities, they really wanted the ability to offer this training in person and be able to have those that role play element and that discussion, recognizing the importance of that. So why we are calling it Oregon COM is because we are adding in, we added in research from Susan Keyes, kind of previous to the research Alyssa talked about, really talking to gun owners about rural gun owners, about how they would like their healthcare professionals to talk to, particularly primary care physicians, to talk to them when they may be at risk of suicide or someone they love may be at risk of suicide, and talking about firearms. So we call it Oregon COM because we felt it was really important to add in pieces of that research and findings into our COM curriculum. So the Oregon COM curriculum is called Oregon COM because it has been certified by National COM to be that Oregon can provide that, and we've gotten approval to add those extra pieces in. My understanding is there are some national efforts with COM to around the in-person and train the train model. So we're one of the first. There are a couple other states that have taken this on, but we're excited to meet this request from communities and start to get this out. So we're really developing some of the materials still. Glad that Charlotte and Michelle are moving this forward and looking to promote this more in the next couple of months. But I'll stop there because I don't know if any speakers are here and I don't want to take up too much time, but happy to answer any questions. And if you do have questions, feel free to reach out to me. I'll put my email in the chat again.
Thank you for taking that over, Megan. You always state it so eloquently and so comprehensively. So I really appreciate that. I just thought it was a great time to kind of highlight that all of the work you all are doing is really going into a good form and spreading across our state. As Megan said, we are also doing trainings, which I know Jen has already sent out before, but there are some open spots still on a couple of them. So I put our website link if you are interested in signing up for it.
Thank you so much, Charlotte and Megan. I really appreciate that. Jonathan, you had your hand raised?
Yeah, and I do apologize, everyone. I've been dealing with a stress headache all day, and it's been difficult looking at the screen. But I did notice a question, reviewing the questions. I wanted to speak to Jill's comment about, making it hard from the findings from the focus groups and the firearm owners about less legislation, less, OHA involvement, that they might be more resistant to those changes. If I could speak to that a little bit, that is a very, those of us who facilitate the focus groups, we weren't surprised by that, but also that was something that we, wanted to recognize as a challenge, because we're making recommendations. We walked into the focus group. Our main statement was, we want to make sure that the voice of firearm owners are represented when we make recommendations to legislation. So they knew we were making recommendations to legislation. And we wanted to make sure that their voice was represented. So what they spoke about was more of a grassroots movement, that if it came more from firearm owners, then they might be more likely, and not just firearm owners, but other firearm coalitions and associations. And so we kindly gave a little bit of pushback and said, that's a great idea. So what is happening in the firearm owning community around suicide prevention? And so as the report was happening and being made, there was, we have, she's going to join us later, but we have somebody working with us, volunteering with Lines for Life, who helped with the report and the findings. and saw that there was a huge need in our state to bring firearm owners around the common denominator of suicide prevention. And so while those recommendations were being made, the Oregon Firearm Safety Coalition was formulated simultaneously. And so that has been going now for over a year. And maybe someday we'll be able to hear from them in one of these webinars about the great work that they are doing. And it is I can say I sit on that coalition, and it represents across the political spectrum, people from all sides of the firearm issues. And now they are doing QPR trainings in shooting ranges throughout Oregon. We have gun shop owners that are doing more suicide prevention training and promotion. And there's just been a lot of great work getting firearm owners around the one common denominator, and that is suicide prevention. So we'd just like to celebrate that. And I think that goes back to the work of this work group from the very beginning, that prioritize firearms and prioritize speaking to the firearm owning community to hear what the recommendations were. So I don't know if I answered that question that Jill put. So I think what we're hearing, what we're seeing is that this work can be done simultaneously.
Thank you, Jonathan. Yeah, and I think too, from even the little that I've been able to like talk with Donna Marie about the Oregon Firearm Safety Coalition, is just being able to kind of have, and as the focus group, Alyssa, with what you were sharing from examples, just when those recommendations and suggestions and plans and ideas are coming from like other firearm owners, it's kind of like it's coming from somebody who gets it. And I think that may also be contributing to it. It's a community-led thing from somebody who understands and like speaks the same language in a way. And I think that we find that to be like the case, not just among like firearm owners, but across like multiple groups too. Just being able to hear it from your peers and being able to work with your peers in the community and create that group, that interconnected group, is really important. Oh, go ahead, Jonathan, you unmuted.
Yeah, and I just think too that one of the things that we've seen is that, so when these laws are coming out, we've been able to see a little bit more buy-in from the firearm owning community, because they've been privy to it, they've read it, they understand it, and while they can't necessarily make a political statement, they can say, oh, I can get behind that because I was part of those conversations and we have buy-in to that. They asked me, they asked my opinion. And so therefore I was able to say, yeah, I think that's a great idea. More, giving us credits for lock boxes. Absolutely. That we can get behind that, and those kinds of initiatives.
Yes. And I see your hand raised, but before that, really quick, I just want to mention a comment that was up in the chat box a little while ago that just Angela shared, that Angeles County relies on the attending sheriffs to request investigations from ME investigators on overdoses as possible suicides, which could leave a lot of room for bias from law enforcement on making that call. Thank you for bringing that up, Angela. That's one thing that we've been learning about just different medical examiners, or even, and also when we just recently had somebody from Multnomah County, Canada, come to our group this past week and talk about psychological autopsies, and just seeing like that importance of being able to have that connection with your medical examiner and just what that looks like, and how it's also just very different from county to county depending upon resources. And that also speaks to Pam's point too, about how it's just sometimes really difficult to know if the overdose was intentional, was it accidental, and all of that. So thank you for bringing that to our attention, Angela. Annette.
Well, I will just build on that. I was seeing Justin's question about, do we have law enforcement engaged with this? And Justin, I don't know if you're comfortable talking. I just would love to hear your thinking a little bit about that.
Yeah. I mean, with the high rate of suicide amongst law enforcement officers, on top of the fact that they're highly visible out in the community, often in our schools, it just seems like they would be in a prime position to offer some element of training or education out into the community about gun safety, particularly focused on the element of suicide. I know I've worked with DPSST a fair amount. They do all the training for new officers at the academy, and I don't know if they have a big section on suicide specifically, for law enforcement officers, but they have been continually adding more mental health elements into their officer training. And so I would think this would be as good a time as any to include them in those kind of discussions.
Thanks, it's a good thought. I also, and it's interesting with law enforcement because there's people where having law enforcement engage will really engage folks, and then there's other groups where having law enforcement engage doesn't. And so I just think it's an interesting thing for us always to sort through, but it's absolutely true that there's this high suicide rate for folks in law enforcement. So just having them really have this information in safe storage, just even in their own community, would be a huge thing. I'm curious, as some of you who are connected to either an organization or a coalition, are any of you doing any activities or trying to think about doing activities around access to lethal means? Okay, no, I think Clackamas County's been doing a fair amount of work in that area.
Yes, they're gonna be our last speaker for today's webinar. And Donna Marie has actually been working really closely with Clackamas County Suicide Prevention Coalition around connecting with different folks with that in the county.
Can I answer a question that Claire had in regards to Oregon Comm training, because everyone might have it? So yes, the free one that is listed on the Zero Suicide is shorter, definitely has detail. The question here, I think, is what is the difference between the Oregon Comm one, as it's 4 hours long? It is longer. Again, it also brings in a lot of specific Oregon data and information, since we have so much rural involvement, tripping over my tongue here today. And it also involves practice times where you really get to interact with this material, which we, Michelle and I anyways, with Insight Agency for Change, with the many different types of trainings that we provide around suicide prevention, have found to be a really, really great way to start learning how to have those conversations, right? So whether it's just asking the question about suicide, but then also, as you all have brought up, there's a lot of different things that can come up specifically for gun owners. So this, the Oregon Comm training does spend a lot of time going into depth around those topics, how to have the conversation, how to approach it, similar to some of the items that were brought up in the first presentation today.
Thank you, Charlotte.
I'll just jump into and mention that there are 3.75 CEUs available through the NASW if you're interested in those.
Thank you. And Claire, are you able to speak to the request that you had put in the chat about who and how? Can you talk more about that question?
Yeah, this only came to me after helping with a postvention actually, but I'm curious how we could like refer our school partners to like where to get resources in each of their counties, and like what's free and what do they need to set aside money for, and just like who a contact is for that. I mean, I recently just dropped off like gun cases and locks to a school district to have on hand, I believe. And I thought that I'd never thought of that before. So yeah, I'm just like wondering how our program can promote and like connect local organizations to support that. And or what is also provided for free.
I was holding out to see if Annette wanted to speak to that, but I'll speak up. I can tell you that Annette's team has been working really hard, getting some funding from OHA and getting lock boxes to local mental health organizations throughout Oregon. And so that's one means of access that communities now have. I don't know how each county is handling that or distributing those. If they're only for clients who are activated, or if they are just for any community member. I think that's county by county. I don't know, Annette, do you have
Yeah.
more clarification on that?
Yeah, I think it's something the Oregon Health Authority gave us funding to provide to community mental health programs for lock boxes for medications, for long guns, which are like rifles, and for pistols and shotguns. And they've been distributed in a variety of ways through the community mental health programs. Some of them are doing it in a very kind of, as part of a discharge process or part of safety planning. Others have done it at fairs. There's been a variety of ways to do it. We've had enough of them that we've been able to also have a few other organizations, particularly with the medication boxes, ask us for them. But what's become really clear is that the need is larger than what we have, even though it was quite generous. I mean, I can't remember, Jill's on here, but something like 70,000 boxes of different kinds that we are providing, and yet still we're running out. And so it's a clear, folks are seeing that it's something useful to have. And so we're hoping that there'll be more and more opportunities for those kinds of protections to be offered. And I see Gordon Clay's also been saying that at their coalition, through their Veterans Task Group, they've been providing gun locks, which is a starting point for helping with lethal means access.
I think something that we weren't expecting too, Annette, with that program was that the long guns ran out the fastest, right? Like those were like gone super quick. Like CMHP's really requested those really fast. So we weren't expecting the demand for that to be so high. So that's something that we learned. Thank you. Donna Marie has joined us to be able to share on the Oregon Firearm Safety Coalition. So thank you all so much for all the really amazing and great conversation and discussion. If you have more questions, please feel free to add them into the chat and we will get to them as able. And now I will turn it over to the amazing Donna Marie.
Oh, well, that's a very lovely introduction. And thanks for your patience. If anybody had to wait for me, I was, okay, that's great. So the Oregon Firearm Safety Coalition, a little bit of our history, as it may already been spoken about, Lines for Life were asked to conduct focus groups with firearm owners for the Oregon Alliance, for the YSIP program. And the Lethal Means Work Group were sort of charged with looking at this information and making some recommendations. And when I was looking, or when we were looking at a lot of these results and stuff, there were some things that really stood out. And that was that suicide prevention, a lot of folks felt that that was code for gun control and therefore were not engaging in any kind of suicide prevention. There was a lack of trust of information when it came from folks that were not gun owners. So when somebody that was sort of saying, hey, could you do this? Or how many firearms do you have? And stuff like that. And how are they stored? If it was coming from somebody that they felt wasn't really part of the gun community in any way, that they didn't really trust their motives, even though the motives were definitely to keep everybody safe. And we also realized that nobody was actually working alongside the firearm community. We had amazing people that were doing work in public health and suicide prevention and in primary care and behavioral care. And then on the other side, we had firearm owners. And there just seemed to be a gap that really needed to be bridged. So with that in mind, we started to look and see what other states were doing. A lot of other states had been, having the same issues that Oregon has with firearm related suicide. And there are a number of the states had things like firearm safety coalitions or gun shop projects. Some folks had off-site storage maps for people to store firearms outside of the home when needed. And the one thing that all of these projects had in common was that they brought the firearm owners to the table and they were working together on solutions. And at the same time, we started to have conversations with firearm owners in Oregon, and a lot of community members had the same sort of reaction when we were discussing suicide prevention. One, that they didn't realize the scope of the issue. People did not realize that 80% of all firearm related deaths in Oregon were suicide, or that half of all suicides in Oregon were firearm related. So the firearm community, to our sort of surprise, were like, wow, how do we change this? How do we stop this? They really wanted to be a part of the solution. So with that in mind, and sort of looking at what other states had done, what the firearm community was saying that they wanted, we decided that we too should have a firearm safety coalition. The name was not very creative. We called it the Oregon Firearm Safety Coalition. That was taken directly from the New Hampshire Firearm Safety Coalition, who were the first folks to work with firearm owners back in the 1990s. And with the support of Lines for Life and mostly Jonathan Hankins, who I was working directly with at the time, we launched the first Firearm Safety Coalition meeting, and that was 18 months ago. Next slide. So we have been having meetings for the last 18 months, and this work is incredibly necessary because not only have firearm related suicides been an issue historically, firearm sales over the last 2 years have increased in ways that we have not seen ever before. We know that there has been a 60% increase in sales since 2019, which is more than 21 million firearms in less than 2 years. And they're the firearm sales that we know about because not every state has background checks. We know in the last 24 months, there's been about 1 million firearms sold in Oregon, and 40% of those were sold to first-time buyers. So our group that owns firearms today are a very diverse group of folks. It is not just rural folks. It is not just white folks. There's been tremendous increase in groups like the LGBTQ plus folks in our BIPOC community. Women are owning firearms at rates that have not been seen before. So we think today that there's probably firearms in about 50% of all homes in Oregon. So this is definitely an area that we need to continue to focus in. And we need to continue to focus because new research shows us that for a male that owns a handgun, they are 8 times more likely to die via that handgun than a male that doesn't own one. And for a female, females are 35 times more likely to die via their handguns than a woman that doesn't own a gun. So we know that by simply owning a firearm, having it in the house puts you at risk. Not because you're going to have more thoughts of suicide than somebody that doesn't own a firearm, but just because you have access to a means that is simply so lethal. As I stated earlier, we know that 80% of all firearm-related deaths in Oregon are suicide, and that firearms account for at least 50% of all suicides, and that number increases to almost 80% in some of our rural areas. So this is work that really needs to be done. Next slide. So we brought everybody together that we could think of, and we continue to grow. We added about 5 new members to the coalition this week alone. So we have folks from the suicide prevention community, the firearm community. We work with our veteran community because our veterans have a high rate of suicide, and 70% of our veterans use firearms as a means for suicide. And we're working with our public health community as well. So we have folks like Lines for Life, American Foundation for Suicide Prevention, Oregon National Guard. We're working directly with counties, Clackamas County, Washington County, Yamhill County. On a national level, we work with folks like Hold My Guns from Pennsylvania, Walk the Talk America, which are out in Nevada, Safer Homes, Washington, our neighbors, they're doing amazing work. And you folks, In our firearm community, we have the 3 largest gun clubs in the state, which is the Tri-County Gun Club, Douglas Ridge and Albany Pistol Club. We're working with the National Shooting Sports Foundation, the Liberal Gun Club, the Oregon State Shooting Association. We're working with Oregon gun owners. We're working with firearm retailers, the Kids Safe Foundation, which does amazing work teaching children not to touch firearms if they come across them. And we are also aligned with the Democratic Party of Oregon's Gun Caucus. We do some work with them, especially around laws pertaining to transfers when people are at risk for suicide. We have launched the Together with Veterans program in Clatsop, Tillamook, and Columbia County, which is aimed at suicide prevention for rural veterans. We have also formed a partnership with the Veterans of Foreign Wars and Healing Waters, which does amazing work with our veteran community. In our public health, we have folks like Megan Crane, Emily Watson, Susan DeFrancisco, Kathleen Carlson, and Kim Rep, all provide amazing advice and support for the work that we're doing. Next slide. So what have we been doing? The last 18 months, we have built a coalition of over 60 members, getting closer probably to 70 members at this point. And we all come into the space and we focus on one thing, and that is reducing suicide that involve firearms. We have developed relationships, rapport, and trust within the Oregon firearm community. We formed the partnerships with the Oregon State Shooting Association and Oregon Association of Shooting Ranges, and they are really powerful relationships because they have clubs and ranges across the state, and they are working hard to make sure that suicide prevention is front and center at all of their clubs and ranges. They're trying to bring things like QPR or question, persuade, refer training into the clubs. They're bringing in new member orientation that involves suicide prevention. So they're really working hard to make sure that they're leading the way with all of this work. We've been connecting county suicide prevention to local gun clubs. Clackamas County has been working with Douglas Ridge Rifle Club to bring QPR training and just really connecting with the firearm community, listening, hearing what their reservations are, and then finding ways to work with them together. We've introduced QPR to Washington and Clackamas County gun clubs. We've brought a suicide prevention module to the 3rd largest gun club, new member orientation. We continue to develop relationships with county suicide prevention. The meeting before this, I was with law enforcement and folks in Deschutes County. That seems to be the next county that we're going to be connecting with. We are an official partner with the Clackamas County Suicide Prevention Coalition, and we're very proud of that and the work that we're doing together. We've launched the Together with Veterans program, formed partnerships with the Veterans of Foreign Wars, become an Oregon National Guard resource partner, and we have collaborated with the American Foundation for Suicide Prevention to produce the first Oregon firearm suicide prevention video. So this is a video that other states sort of have. We wanted to create our own, and it has been made by gun owners for gun owners. So they, talk about signs to look out for if you're struggling, and then all the things that you can do to create time and distance between a person at risk and a firearm, because we know that creating time and distance is the best way that we can keep people safe. Next slide. So our goals for 2022, we are continuing to work to connect county suicide prevention with their local firearm communities, whether that's gun clubs, gun ranges, veteran programs, whatever it is. We know that this is a job that we need to do together. So bringing people together to hear each other, to listen, and to find solutions is definitely a priority. We continue to work with our veteran and military connected community around suicide prevention strategies. We're providing suicide prevention training for the firearm community, whether that is QPR. Sometimes we're working a lot with the American Foundation for Suicide Prevention, so there's Talk Save Lives. any training that we can get in there, we're getting in there. We're also providing counseling on access to lethal means for healthcare providers, and firearm culture training. That is definitely something that we're working on so that we can really begin to bridge the gap between folks that are at risk for suicide and own firearms and the folks that can really get them the help and support that they need. We're also working on bringing offsite storage for firearm owners. Again, we know that the best way to keep people safe is to create that time and distance. So we want to create as many offsite storage locations as possible throughout the state and create a map so that anybody that's having a hard time or just feel like they need the firearms out of the home can find a location that is nearby. We're working on a gun shop project, and that sort of means that we're connecting with any location that sells firearms or ammunition to really work with them to have posters and information up around firearms and suicides. We're hoping that they will also partner to provide offsite storage. And finally, we really want folks to send information and resources home with each firearm sale. So every time you purchase a firearm, you will get a short pamphlet resource guide that talks about the risks, things to look out for, and ways that you can create time and distance, and hopefully a link to that offsite storage map should they need to use it. And then finally, we're working to be culturally responsive to other groups of firearm owners. So we know that a lot of people are owning firearms in Oregon. So we want to make sure that we have trainings and resources and support for folks of our LGBTQ groups, people that are from our BIPOC community, our Latinx community, and we know that it's going to look different for every community. So we're working to bring those members together to sort of help us create some material that will help keep everybody safe. And I think that's the end of my slides. I had 10 minutes, so I may have mouthed through all of that. Yeah, if anybody has any questions or wants to give us money, you just let us know, because we're here and we're doing the work, and it's all because of the Oregon Alliance and Lines for Life. So thank you.
Thank you so much, Donna Marie. Do folks have any quick questions for her before we transition over to our final presenter? And if not, no worries, there may be time at the end for final questions. Okay. Well, without any more waiting, our final presenter is going to talk about what this work can look like at the local coalition level. So we have Gallie Murray, who's our current chair for the Alliance, and Gallie is also the Suicide Prevention Coordinator for Clackamas County and works with the Clackamas County Suicide Prevention Coalition. Your titles are very, very long, Gallie. I'm just saying. They're all very long.
Hi, folks. Super happy to be in this space with everyone, and thank you so much for the invitation to talk about the work that we're doing. Again, I'm Gallie Murray. I use she, her, hers pronouns. Like Jen said, my primary role is the Suicide Prevention Coordinator for Clackamas County, and then I have some other hats that I wear as well. But today I'm going to be talking about the work that we're doing in Clackamas County, specific to our coalition, which is known as the Coalition to Prevent Suicide in Clackamas County. The main thing that I want to share, and I don't have a slide deck, is we, about a year or so ago, our coalition decided that we needed a strategic plan for our community. And so basically over the past year plus, we have been working with the University of Oregon and Dr. John Seeley and his team to develop a external facing suicide prevention strategic plan for Clackamas County as a whole. And essentially this plan is a plan that is a first of its kind. We've never had one in Clackamas County, and I don't believe a lot of counties or few counties have them that I know of, specific to suicide prevention. And we spent a lot of time holding listening sessions, focus groups. We did surveys and asking our community, people who lived and worked in Clackamas County, what it was that they felt were priorities specific to suicide prevention. And one of the things that came up very, very clear was reducing firearm-related suicide deaths. And so that is going to be one of our very few but important priorities that we have on our strategic plan. So I'm going to talk a little bit about that today. And I love that I'm in the coattails of Donna Marie, because a lot of what we're doing really has a lot to do with what she's leading in the Oregon Firearm Safety Coalition. So, you know, the first thing that I'll say that we did is that the coalition, as Donna Marie mentioned, we have a formal partnership. Our coalition has a formal partnership with her coalition. So our steering committee that we have basically adopted is the only formal partnership we have with any other group. And they wanted very clearly to link ourselves to the work that Donna Marie and the Oregon Firearm Safety Coalition is doing. So we have that relationship, which is a lovely relationship that we have had, that we really appreciate having. The second thing that we are doing, and this is with partnership with Oregon Firearm Safety Coalition, is that we do have a formal relationship with our Clackamas County Sheriff's Department to do this work. And this is a relatively new thing that is, kind of just come down the pike in the past couple months. And basically, we approached our sheriff's office and said that, the gun community really feels that the sheriff's department is a credible group of firearm owners. And conversations included having our deputies go into gun retail stores and approach our gun retailers around displaying materials from the NSSF, and also inquiring about whether or not a gun retail store would be able to provide off-site temporary storage of firearms. And then lastly, the deputy will plan to ask them, would the gun retailer be willing to distribute suicide prevention materials with every single sale? So that is something that we are actively working on. Donna Marie and I are going to be working on essentially a toolkit that we will give to deputies. And they will be able to go out into retail stores and have these conversations. The other thing that we're doing is, again, a partnership with Oregon Firearm Safety Coalition around supporting Douglas Ridge Rifle Club in providing quarterly question, persuade, refer trainings. Our first one is scheduled for March, and it basically reached capacity times a zillion in a very short period of time. And Donna Marie and I and Douglas Ridge are actively trying to figure out other dates to provide, because it filled up really quickly. And it's amazing. Like if you create these opportunities, people will come. And the feedback that I'm getting from people is that this is an amazing opportunity. They are so excited to see it happen. It's about time. And, thank you for the opportunity. And what I hear over and over again also is it's really great that the county is not leading this work, and that the gun community is leading this work and the county is following behind. And that's how we have been successful thus far, is that I represent the county, and sometimes historically, I have not always been welcome at all the tables. But this time, the gun community is saying, thank you for letting us lead this work. Thank you for not telling us what to do. Thank you for supporting this work, and just letting us do what we know to do and what's the right thing to do. And we have accomplished a great deal with that kind of thinking and strategy. And frankly, I've done very little except for just say, this is amazing, let's keep doing it. And what can I do to get out of your way and open up more doors? And it's been quite successful so far. And the last thing that I'll say that we're working on is, again, Douglas Ridge Rifle Club, which is located in Eagle Creek, Oregon, which is part of Clackamas County. They will be leading the way and developing a firearm cultural competency training for healthcare providers. And we recognize that there are trainings out there, and my hat is tipped to Dr. Susan Keys and Oregon Health Authority and many other folks who developed the video around supporting providers in rural Oregon and rural areas around how to have conversations about firearms. And that is an amazing video. If you haven't seen it, you should check it out. This video that we are going to create is going to be created by gun owners for healthcare providers. And we are going to be holding focus groups to figure out what types of questions we should be, what types of questions we should be asking, what types of things we should be including, what experiences have firearm owners had with healthcare providers that have kept them from accessing mental health care. We're hearing a lot of stories about, I didn't seek care because I don't want my guns to be taken away. And we know I'm a licensed clinical social worker, and I was a practicing clinician for a very, very long time in settings that were working with folks who were acutely suicidal. And never once did myself or one of my colleagues in the many, many years that I practiced ever even contemplate, taking an extreme risk action to request that someone's firearms be taken away from them. But there is this myth out there that we will take firearms away. So this training is going to be, again, something that is driven by the gun community and starring the gun community, and healthcare providers are going to have a say in what goes in it, but it will be led by the gun community. And the idea behind it will be to demystify gun ownership and destigmatize conversations about firearms in healthcare settings. It will also provide the gun community with a list of providers that have gone through this training. And so firearm owners who maybe are hesitant or reluctant to seek mental health care will have essentially a list of trusted folks who they could go see, who are clinicians who have gone through this training and are seen as credible providers because they've been trained by the gun community to do this work. So that is in the very early stages. And again, Donna Marie is a crucial component of this work. But we are super excited about the direction that our coalition is headed, specific to reducing firearm-related suicide deaths. And we have a lot of work ahead of us, but we have done a great deal in a very short period of time. And I have so much faith and optimism in the work that is to come. So I'll stop talking and answer any questions people have.
Thank you so much, Galli. I feel like you condensed so much work that's been done in such a short amount of time. There's really so much work has been done, like over years, especially with the strategic planning process. So you've really led the coalition in amazing work. So thank you so much for sharing that today. Do folks have any questions for Galli around what it looks like to do this at the local coalition level, or even just kind of what this all looks like? Do folks have any questions, comments?
Galli, how did you get that relationship going with the sheriff's department? Is that something that already existed? Because that sounds like that's been really instrumental in you being able to do this work.
Yeah, I mean, one of the things that Donna Marie and I talk about a lot is that this work is so relational, right? And you all know this, right? Like, and to be honest, none of the work that has happened thus far around engaging the gun community would have happened had Donna Marie not reached out to me like less than a year ago. I mean, all of this work has happened in a very short period of time. And Donna Marie has helped me do a lot of this stuff. But the relationship with the sheriff's office has come from the relationships that I have with our actual sheriff and with our undersheriffs. And so when Donna Marie and I were talking about some next steps that we wanted Clackamas today to take, and Donna Marie suggested, like, the gun community really does see our sheriff officers as our deputies as being credible. I just asked our undersheriff, and our undersheriff said, absolutely, yes, we will be involved in this.
I wonder if people of color in Clackamas County have a similar view of the sheriff or not, and sort of if you have, I mean, I think it's incredible your work you're doing, but also I'm thinking about not going after the usual suspects too and helping with some of this.
No, and you raise a really good question. I mean, our community is not any different. when folks come to like experiences with our law enforcement. You know, some people have had really good experiences and some people not so much. And you know, it wasn't that long ago that we had a Black man in custody at our jail die from suicide. So you know, our deputies, you know, there's a lot of really understandable concern about what it means to be a person of color and having contact with our police versus being a white person. So you raise a really good point, and something definitely, Annette, that we will keep in mind as we move this work going forward.
Yeah, I mean, Gally, I think we all need to work. I think that there is no one route for any of this. The thing is, we've got to get so good that we have these multiple pathways all over the place where people are going to have a way to be supported around being safe in those moments of crisis.
Yeah, and I think, you know, just to echo that, like, this is one path that we're taking, but then we need that culturally responsive work happening at the same time. We need to be bringing the Black community together, and there's a very strong Black gun owning community, and we need to be asking them, how can we support you in this work, and sort of get work groups going. And the same with our Latinx community, who we know are buying firearms at rates that haven't been seen before and are having increased rates of suicide. So it's you know, so we're like one path for this group, and then we need all these separate avenues for all of our other groups. We need stuff in Spanish. We need we have a huge Eastern European community. We need to, each community needs to be looked at its almost on an individual way, because there's such different language, such different culture, and we want to make sure that we're addressing all of that, and we're going to.
And one of the things that I think of, I mean, I'm in Jefferson County, and we're kind of a desert in, say, law enforcement buying into much of anything helpful, and to put it mildly. And I mean, our law enforcement pretty much protest anything. And so, I mean, it sounds like Clackamas County is kind of on the other end where they, I mean, I'm just wondering, maybe like on my end, maybe like sheriff to sheriff might be helpful. You know, maybe as other sheriffs buy in, you know, maybe kind of like picking up the phone and saying, hey, you know, I found this helpful, you know, rather than some social worker going in, you know, they'll laugh me out of the room.
Right.
I don't know.
Right. No, Vicki, I think that's a great idea. And they, you know, the sheriffs, as you probably know, the sheriffs get together, you know, at their sheriff meetings every so often. And I think this is one way to spread the news about what different counties are doing and different opportunities that people have to share this work. And, you know, and once we figure out the things that work and the things that don't, I mean, we would be happy to share that with other folks along the way, so people don't necessarily have to have the lessons learned that we are probably going to encounter.
I don't know if you caught that question from Gordon about, I bet, Gordon, this question maybe to this whole group is, are there special efforts focused for the sort of the 10 to 24-year-old or 15 to 24-year-old? What do we know about this access for young people?
I was just writing back a little bit. Really, I mean, the safe storage bill that came through in 2021 and really advertising that and creating safer storage opportunities in the home for the under 18-year-olds is what's being worked on, because access is like everything. So people, if a youth cannot gain access to the firearm, then it's harder for them to use it for suicide. The 18 to 24-year-old is harder because these are youths, but they could be living independently. So they are choosing to access, you know, to store or to not store. So with that, that's a little bit trickier because these are not normally the groups that are at gun clubs. So what we need to be doing is we're having a lot of conversations about how to reach gun owners that are not part of gun clubs and stuff like that. So how do we reach the 22-year-old firearm owners? Where are they hanging out? So the first thing is, yes, we're definitely thinking about it because too many of our youth are dying by suicide that involve firearms. So our next step is sort of, where are they hanging out at? Finding those locations, finding those communities, and then getting the messaging there, and really creating like almost buddy systems. How can people be supporting each other? If you've got two 22-year-olds that are sharing a flat together, then how do we have conversations about watching out, creating buddy systems? But it's definitely, it's a more trickier area because they don't normally have partners at that time and they could still be living independently. So, but we're definitely thinking about it and working to try and figure it out, if that is helpful.
Thank you all so much for your time and for presenting. Just looking at time, it is 2:30 at the end of our webinar for today. If there are still additional questions or comments or concerns that folks have, feel free to put them in the chat and I can get them to the correct presenter, or you can send me an email and I can get it answered that way. I just want to really say thank you once again to all of our presenters that were able to come today and share what's happening in this across the state. And there's just really, really great and amazing things. So I feel like this was a pretty, even though the subject matter that we were talking about today was heavy, I feel like we can leave with an air of hopefulness, seeing all the things that are being done across the state from our different partners. So yeah, thank you all so much. And I look forward to seeing you. I'm going to stop the recording really quick before I forget to do that and then close it. I don't know what happens. So hold on.